Welcome back. As Nigeria and Switzerland mark the 10th anniversary of their migration partnership, both countries are strengthening diplomatic relations to fight illicit movement across borders. But such partnerships to manage migration have never been easy, and Nigeria's Minister of Humanitarian Affairs, Sadiya Umar Farouk, says numerous and diverse challenges continue to manifest. Correspondent Biami Momo compiled the report.
Relationship between Switzerland and Nigeria dates back to the late 1990s when a large number of Nigerian citizens arrived in Switzerland seeking refuge and asylum. Both countries waited to sign their Memorandum of Understanding in 2011, allowing both sides to tackle and address issues affecting them. These issues include the fight against smuggling of migrants and trafficking, return and reintegration, protection of human rights, and the promotion of regular migration. At this 10th anniversary to mark the partnership, the Nigerian government is particularly pleased with the uniqueness of this decade-long exemplary relationship between Nigeria and Switzerland. What is key is that the partnership is built on mutual trust, respect, progress, and openness.
Nigeria believes in strategic collaboration, partnership, and has engaged and entered into bilateral and multilateral partnership, both intra and intercontinental. In all this, the Nigeria-Switzerland bilateral partnership is outstanding and enjoys a unique kind of strategic relationship based on mutual trust and respect for each other.
Despite the challenges faced all over the world due to the COVID-19 pandemic, this 10th anniversary is a huge milestone for both countries. Over the first decade of the Swiss-Nigerian migration partnership, 50 innovative projects have been successfully implemented.
Particularly pleased that we are able to mark this important milestone of our partnership despite the difficulties we face due to the COVID-19 pandemic. Over the past decade, Switzerland and Nigeria have implemented more than 50 projects in areas such as migration management, preventing irregular migration, combating human trafficking.
It is important to note that despite the partnership, the aspect of regular migration hasn't seen much change.
It is important that all areas of this agreement be treated equally. However, we must also not forget that migration itself is beneficial, not just to sending countries, but also to receiving countries as well.
Despite the challenges and obstacles faced, it is hoped that this unique partnership will continue to evolve and grow stronger.
And now on health matters, the federal government restated its commitment to ending tuberculosis infections in Nigeria. Nigeria's Minister of Health, Osage Henry, made this pledge during the commemoration of this year's World Tuberculosis Day. Our correspondent Aisha Olaoye completes the story. A 2019 Global Tuberculosis Report estimated that 429,000 people in Nigeria have tuberculosis each year. This makes Nigeria #1 in Africa and globally 6th amongst the 30 high TB-burdened countries. The World Tuberculosis Day is a day set aside to heighten the awareness of the global impact of this infectious disease. Tuberculosis remains a huge health concern for government even as it battles COVID-19. He highlights important milestones recorded in the eradication of tuberculosis in Nigeria.
I am delighted to address you on this 2021 World Tuberculosis Day. Interventions to improve access to TB services include the following. 1. Number of installed gene extract machines expanded from 32 in 2012 to 403 currently. In public and private facilities, expanded from 3,931 in 2010 to 17,699 in 2020.
This year's campaign theme, "The Clock is Ticking," was initially due for launch last year but postponed due to the COVID-19 outbreak. Nigeria's partners like the USAID, WHO, and others say they will continue to support Nigeria until it wins the fight against tuberculosis.
It's my great honor and pleasure to be here today to affirm the U.S. government's commitment to supporting Nigeria to achieve those ambitious targets that were set as part of the UN high-level goals to get control of TB in Nigeria and improve the lives of all Nigerians.
It is worth noting that taking appropriate medical measures such as proper hygiene, covering of our mouths and noses when coughing or sneezing can prevent the spread of tuberculosis. Doctors also advise getting tested and treated if such symptoms of TB get noticed.